Hi guys, so here's my Care Peg night routine. We'll need a 20ml syringe, a 60ml syringe, some saline water, sterile gauze, just some normal water. I like mine to be chilled. Of course, pain relief and this amazing steroid cream that I use for my granulation. And then a range of different dressings and plasters. This Grip-Lock one is insane. I really recommend you try and get it prescribed to you. And then we'll need some scissors and a glass. This is the current situation of what the site looks like. It does look quite gross and it is, it's very crusty. So I'm just going to give it a quick clean now using the saline water and sterile gauze. I'm quite I really try and clean it as much as I can. I wipe all around the peg, try and get quite in the site and all around the tube. As you can see at this point, I did actually bleed, but it's because of my granulation. I can't help that at the moment. I'm just placed some sterile gauze there just to stop the blood, coming out and down my clothes. So I'm just prepping a 20ml syringe for the after flush. And I'm getting my 60ml syringe and I'm going to just flush my tube with this. This will just clear out any backflow from my stomach. So just getting the air out and ensuring the clamp's on. And I'm just then going to put this 60ml of just normal water slowly down my tube. I'm just ensuring the clamp's down and disconnecting my syringe. I'm then going to pour some water in this glass and dissolve my Cocodamol tablet. This helps with all the pain that I've got recently, especially due to the granulation. I'm getting quite a lot of burning sensation. I'm then going to remove the gauze and apply my steroid cream. This stuff is insane and you can buy it over the counter and I really, really recommend. Also for eczema as well, because I've been having quite bad eczema on my face and this works a dream. So I'm now taking this really cool foam pad thing and I'm just going to place that over the top of the bumper just to ensure, it's got a bit of comfort there. It stops any sort of digging or irritation. I'm then taking this big over plaster thing, just trying to work out how to cut it. And I'm going to stick that over the top of the foam as well. So as you can see, I'm just trying to move the bumper out the way and just trying to find a good place to stick it. Once that's all stuck, it looks something like this. And I think it just looks really neat and it really helps, with the granulation. So now I'm just putting in the Cocodamol and then my second flush to flush all the medication through. And that is pretty much it.